Hello and welcome. We're pleased to have people joining from all over the world to take part in a conversation about research advances in progressive MS, a disease which impacts the lives of millions. Today we're coming to you live from the International Progressive MS Alliance Scientific Congress in Vienna, Austria. This important meeting brings together nearly 200 international scientists and MS leaders, including people affected by MS, to achieve progress in developing new, effective treatments for progressive MS. During this webcast, you'll meet Dr. Robert Fox, chair of the Alliance Scientific Steering Committee, and two leading MS researchers, Dr. Laura Airas and Dr. Jessica Fletcher, who are working to develop new understandings about progression, an essential key to accelerating the development of breakthrough treatments. It promises to be an informative and inspiring 30 minutes. My name is Jon Strum. I had the honor of serving on the Alliance Scientific Steering Committee for several years, providing the perspective and experience of someone that's affected by MS. My wife, Jean, lived with progressive MS until her passing in 2020. I also volunteer with the National Multiple Sclerosis Society in the United States, and I host the Real Talk MS podcast, which I invite you to listen to at realtalkms.com or wherever you find your favorite podcasts. Before we begin our conversation, I'd like to recognize our webcast sponsor and share some information about the International Progressive MS Alliance. We're grateful for the generous support of our sponsor, Sanofi. Thank you for helping make this webcast possible. The Alliance is an unprecedented global collaboration to end progressive MS. It includes 20 MS organizations, hundreds of researchers and health professionals, the pharmaceutical industry, companies, foundations, donors, and people affected by progressive MS. In short, the Alliance has brought the world together to solve progressive MS. To date, the Alliance has invested over 24 million euro in research with an overall commitment of 60 million euro through 2025. If you're watching this webcast, you know that ending progressive multiple sclerosis is an urgent and unmet need. It's why I'm so pleased that with me today are three leading MS experts who are working to fuel research to develop new, life-changing treatments. I'm going to begin by asking Dr. Fox to set the scene for us and describe this worldwide gathering of MS experts. In addition to being the chair of the Alliance Scientific Steering Committee, Dr. Fox serves as staff neurologist at the Mellon Center for Multiple Sclerosis, vice chair for research at the Neurological Institute, Cleveland Clinic, and professor of neurology at the Cleveland Clinic Lerner College of Medicine. Dr. Fox, people with progressive MS are frustrated at the lack of treatments that can effectively slow progression. With so much progress having been achieved in developing drugs that address the inflammatory aspects of MS, little has been accomplished in treatments that slow or stop progression. What stands in our way?
So what stands in our way is that progressive MS appears to be very different from that earlier phase or stage of MS, relapsing MS. It's different in that the pathology or what is broken in the tissue seems to be different, and the response to our therapies is different. When we have taken the therapies we developed for relapsing MS and applied it to progressive MS, they generally haven't worked, or they've been generally disappointing results. So what we've come to learn is that we're not even sure what is wrong with the brain that leads to progressive MS. It's a little bit like if your car isn't working, but you don't know if it's an engine problem or an alternator or a battery or a wheels or an axle problem. And if we don't know where the problem is, it makes it even harder for us to identify solutions that can help make things better. And so that is the origins of our struggles with progressive MS, is that we don't really know what's the underlying problem. A second challenge is that we don't know how to do trials effectively and efficiently. We have done trials in progressive MS, but they generally have been very big and very long. What we want to do is efficient, short small number of patient trials to identify potentially promising therapies, or ones that are duds, are losers, and throw them away and move on. And then thirdly, we have not done a very good job in finding therapies to improve the quality of life of people living with MS, to improve their well-being, improving their function, improving their symptoms. And so those are the three main pillars of the challenges that we have with progressive MS, and where the Alliance is focusing their efforts.
Well, overcoming the challenges you've just described is really at the heart of this scientific congress. Can you tell us what's being discussed here in Vienna?
Yeah, so there are three main goals of this Congress, and the origins of this Congress actually date back a couple years when the Alliance issued a request for applications. It was called Challenge Awards, and it was a modest amount of money over 1 to 2 years to overcome specific challenges with progressive MS, specific challenges of what is progressive MS and what's driving it, and what biomarkers can we identify, can we validate, can we utilize to measure progression and response to treatments. And the Alliance awarded 17 grants to answer some specific focus questions, to not just move the needle a little bit, but to think way outside the box and make big jumps. Some of them are risks, and some of them were not going to work, but some of them were going to work. And so to fund specific efforts to identify the underpinnings of progressive MS, what is driving it, and what biomarkers we may be able to use to measure it. So then fast forward to here in Vienna, we have three goals. One is to hear the outcome of those 17 projects, to hear the results of what those investigators found through those 17 specifically funded research grants. The second is to put it in the greater context. Okay, you found that and that person found that, but to put it into a larger context of where does that fit within the field here now in 2023. And then the third, just as important, is okay, given all of that, where are we going? What do we need to do? What do we need to prioritize? What questions now are left or were asked by these recent findings to help propel us forward? So it's understanding the results of these projects, the greater context, and then looking forward.
Well, it's encouraging to think that these projects could help unlock the door to understanding progression. And I'm delighted that we have two of the lead investigators that have received a Challenges in Progressive MS Award with us today, Dr. Airas and Dr. Fletcher. Dr. Airas, as a clinician scientist based in Turku, Finland, is a MS specialist who consults at the Turku University Hospital Neurology Clinic. Dr. Airas conducts research on progressive MS at Turku Pet Center with a special interest in elucidating this central nervous system pathology contributing to MS disease progression. Dr. Airas, your project aims to reduce nerve degeneration in progressive MS and focuses on brain cells called astrocytes. Could you describe your research? And for me and most of our audience, can you tell us exactly what astrocytes are and why they're important in progressive MS?
Yes, thank you for this question. So I'm a clinical MS neurologist, and I've been treating MS patients for a long time. And even if they are treated with the best treatments that we have today, so I still see them start progressing at some stage. And this has really made me interested, and my research group interested, in trying to understand better the mechanisms, the pathology driving this progression. And like you mentioned, being in Turku, so we have a good PET center. And positron emission tomography is actually a technique where we can really look at molecular level at the pathology of the brain in vivo in living MS patients. And this is a really great asset And we have now methods that we can actually study specifically these astrocyte cells that you mentioned. So astrocytes is a type of cell in the central nervous system. It's a non-neuronal cell. It's one of these glial cells, the other one being a microglial cell. But astrocytes are really needed in normal brain to keep the brain functioning, to keep the normal homeostasis of the brain. But we know that in MS, the function of the astrocytes changes and they become detrimental. So for example, they can promote inflammation. They can make the blood-brain barrier more permeable, which can be harmful. And they have these long processes, and they can connect very well to other cell types, like, for example, activated microglia. So these cells work together, again, in promoting the pathology. And if we could do something about this process, if we could stop this harmful process in MS related to astrocytes, so that would be beneficial in terms of the progression also.
So you and your team are exploring potential therapies that could be developed based on your findings that would protect the nerves in people with progressive MS. Can you tell us about this and how these therapies might potentially work?
Yes, so we have identified this key molecule on the surface of these astrocyte cells. So this molecule is called adenosine A2A receptor. And we know that this receptor is regulating some of these detrimental functions of astrocytes. For example, it can entice lymphocytes coming into the brain and coming into the MS lesions. And if we could stop this from happening, this would be beneficial in terms of the progression. And now with the PET imaging, we can actually measure the amount of this molecule on the astrocyte surface in MS brain, and we have seen that in more advanced progressive MS, there's much more of this molecule expressed in the brain. And our in vitro cell culture experiments have also demonstrated these detrimental functions of the molecule on astrocytes, and also that we have shown this in brain tissue slides. So now the nice thing is that there is already an existing drug that we could use to block the function of this molecule. So our next step, our plan, is to actually conduct a clinical trial using this existing drug to block this A2A receptor on astrocytes, and in this way try to stop MS progression. So this is very exciting news, and we can actually use the PET imaging as an outcome measure in this trial. So like Bob was saying, so we could get the results fairly quickly. We don't need to do a hugely long trial, but we could do this fairly quickly.
Wow, it's really wonderful to hear about this kind of innovation and progress.
Thanks.
Dr. Fletcher leads the Glial Cell Signaling Research Group at the Menzies Institute for Medical Research at the University of Tasmania. Her research focuses on the contribution of brain cells called glia to the neurodegeneration that causes progressive disability in MS. Dr. Fletcher, you and your team are working to address the loss of myelin in MS by focusing on understanding how myelin is normally made. Tell us about your research and the important role myelin plays in protecting nerves.
So I'm really focused on trying to find ways that we can promote myelin repair. So one of the challenges in MS is that remyelination doesn't happen as it normally would. And so myelin is really important because it basically controls the timing of when nerves talk to each other. So when you lose myelin, the nerves might not, all the information might travel more slowly, and so you don't have that connections meeting at the right time, which causes some of the symptoms that people with MS experience. The other thing that's really important about myelin is that certain nerve cells also just need it to have like energy support. So it's really important just providing that extra support to nerve cells so they can function normally. And so when myelin is lost, all sorts of things sort of cascade and go wrong. So one of the things we want to do is that because myelination or remyelination doesn't happen in chronic lesions in people with MS, we want to figure out ways we can make the oligodendrocytes, which are the cell types that with the cell type that makes myelin, how we can actually push them around so they make myelin when they don't want to or can't anymore. So that's really the goal of my research, is to find out ways we can push them around so they can make myelin when they aren't doing it anymore.
So tell me, how would findings from your work help in the development of new treatments for progressive MS?
Yeah, so our understanding of actually what happens inside oligodendrocytes, there's a lot that we don't know. And so because we don't know this information, we can't figure out ways that we can actually target that and actually push those or activate those pathways. And so basically, by looking at what happens inside these oligodendrocytes, we can identify new molecules that we can potentially manipulate to make them make myelin, or to say, actually, you're not meant to be on right now, because if you're on, you're actually stopping the oligodendrocyte from making myelin. So it's really about identifying new targets that we can use to make sure that myelination happens when it's not happening.
These are both very exciting projects, and they're only 2 of the 17 Challenges in Progressive MS awards. Dr. Fox, can you briefly describe some of the other areas of research that are being reported here at the Scientific Congress?
Yeah, so the reporting in covers a wide variety of aspects of progressive MS and the biomarkers. It includes metabolic derangements and understanding more of the details and the nuances of the metabolic derangement. It's understanding inflammation, but not the typical inflammation we see with relapsing MS, where the immune system from the circulating blood goes into the brain and attacks it, but it's more the resident, the internal immune system within the brain, and how that gets activated and causes injury and impedes things like remyelination, putting the myelin sheath back on. We also learn about mitochondria, which are the energy-producing organelles within cells, particularly neurons, and how the mitochondria have become activated and then eventually exhausted because they're being overworked, they're being overtaxed and made to work too hard because of the metabolic derangement. And we're learning about how these are integrated together and are all interconnected together. The metabolic derangement, the compartmentalized inflammation, the remyelination, and how they're fitting together like a puzzle, a set of puzzle pieces that then contribute to the progression we see in our patients. And we're also learning about biomarkers. We're learning about imaging biomarkers on the MRI and PET scan that can give us insight into the pathology and then become a measuring stick, can become a metric we can use when we try new therapies to see if they are doing what we're hoping they would do, like with the PET scans. We're also looking at fluid biomarkers, biomarkers in the blood that give us insight indirectly from the brain, but much easier to access in the blood, that can give us insight into what's going on with the brain related to progression and progressive MS. So it's really covering a wide array of things. And then we also have overview talks that are integrating it all together and connecting the individual pieces like remyelination and PET scan and putting it together into a more cohesive story that then points towards the future.
After learning about the results of these projects this week, what are the next steps to continue the momentum in finding new solutions for progressive MS?
Well, learning how these different systems are interconnected and one relying on the other and one reflecting a problem with the other remyelination is not an area in isolation, but is connected to the ongoing inflammation and the inhibitory factors that are preventing remyelination. So I think that the future steps are continuing to integrate them together and then apply them to studies, apply them to long-term natural history studies where we just observe patients over time to see how these different systems are truly at play, and also starting to look at clinical trials, to look at interventions to see if we can change these metabolic pathways to help with remyelination, to help improve the PET scans, which we think will then ultimately lead to improved quality of life, both slowed progression and improvement in the symptoms of people living with MS.
Well, I know we'll all be anxious to hear everything that's shared here at the Congress and how those findings will help speed the development of breakthrough treatments. For everyone watching, please know that we'll highlight the results in future webcasts and be posting a Scientific Congress report on our website, progressivemsalliance.org. We're near the end of our time today, but I'd like to ask each of our experts a final question. At the beginning of this webcast, I shared that people affected by progressive MS have been discouraged at the lack of progress in solving progressive MS, but that finally things seem to be changing. What would each of you want people to know about progressive MS research? Dr. Airas, let's begin with you.
Yes, so I think the key is that we try to understand better the pathology as was discussed earlier here, because then we can identify the targets for treatment. The other thing is that we need to learn to measure better the extent of the smoldering pathology in the brain, because this will allow us to develop new really outcome markers for the trials in order to make the trials shorter and more feasible for patients and investigators. And then I want to highlight the third thing, which is that I think the treatments should be started early enough, because it's always much easier and much better to prevent the damage rather than try to correct the damage after it has happened. So I think this will be a key also in the future.
And Dr. Fletcher, what would you tell people about research in progressive MS?
I would echo Dr. Airas' sentiments. I think we have come a long way, and we are really gaining momentum in terms of developing new ways to measure how we treat MS and how we actually improve the quality of life for people with MS. And I think the other thing, we're also really gathering momentum in how we actually develop brain repair and neuroprotective strategies. And I think the number of trials that are happening and are planned is something that we should all look forward to as a research community and to see what happens next.
Dr. Fox, what would you add to these comments?
Well, I agree with my colleagues' comments fully. I think the best way to try to tackle a tough problem is to gather smart people around it, to identify the major hurdles, the major bottlenecks which are preventing progress, and then outline, design, commission specific projects to overcome those bottlenecks. And I think that's what we've seen in progressive MS and makes now very different than 10 years ago, is that we have really aligned the efforts of the scientific community. We've identified the major roadblocks, and we are outlining strategies to overcome them. So I think the best way to address a problem is to make it clear and get a strategy around it. And I think that's what we're doing with progressive MS.
Today, we shared the results of promising research that will accelerate the development of new effective treatments for people with progressive MS. The Alliance continues to inspire hope and achieve progress. Thank you to our MS experts, Dr. Fox, Dr. Airas, and Dr. Fletcher, and thanks to everyone watching for joining us today. Please stay connected to the Alliance through our regular webcasts and Your MS organization. And please share the work of the Alliance with others. We need everyone to be a part of this worldwide effort. Together, we are stronger than progressive MS.